I'd now like to move to the lower extremity examination. And in order to do this, Mary, we're going to try to expose your legs so that I can see them and perform the steps in the lower extremity. What I'd like to do, Mary, is I'd like to bring the gown or the drape towards the center, like this. And that's going to allow us, if you don't mind, I'm just going to have you roll up the gown there so we can see your thigh area.
Okay.
And we'll do the same thing on this side. Okay. And having the gown or the drape like this just allows us to keep her modesty while also exposing the portions of the lower extremity that we need to inspect. Our first step, as mentioned, is inspection. And so I'm looking at the skin, and I see a couple of little freckles in this area. And I'm looking for discolorations. I'm looking for things I can see, such as varicose veins or exposed veins, any scars, and things like that. We'd look all the way down to the toes and check the nails of the toes, and also look on the soles of the feet. Certainly this is very important in some people that are at risk for skin lesions, and parts of their body that sometimes people don't look at too often on the bottoms of the feet. When we're down here in the pre-tibial area, we also check for edema. In order to do this, we push gently up against the skin in the lower extremity and look for denting, if you will, or pitting edema. Edema can occur anywhere in the body, but it's common that it happens near the bottom due to gravity. And so we check for edema from the foot up to the pretibial area. Edema is gauged on a 4-point scale where 0 would be no edema, 1 would be just a slight bit of edema, 2 would be 3 and 4 would correspond to progressively more edema, as it's noted in the course book. After inspecting and palpating in the lower extremity, we want to check for pulses. And the first pulses we'll check will be the popliteal pulse, which is in this popliteal fossa just behind the knee. Mary, in order to feel this, I'm just going to ask you to slide forward just a little on the table. Thank you. And I just rest my hand behind the knee and slide it just on either side simultaneously, just outside the hamstring tendons that you can feel in this portion of the knee. And I feel for pulsations, and if they're equal on either side. Sometimes I use the cross method for feeling those pulses. We're going to do the next, we'll be checking for the posterior tibial pulses, which are just behind the medial tibia here. And again, I sometimes will use a cross method to feel for the pulses in this area, and they're nice and equal. And finally, the dorsalis pedis pulses, which are located across the top of the foot. Sometimes these are a little hard to find, and one technique is to just lay your fingers gently across the top of the foot with a very large surface area coverage until you feel an area of pulsation, and then that allows you to focus right in over the top of that pulse. And again, I'm using the cross method to be able to feel, though I think you could similarly check each side without having to cross your arms. And those pulses are also gauged as we did the upper extremity pulse. Next, we're going to move to range of motion. Range of motion can be done in a seated position, or sometimes also can be done in a lying position. Today I'm just going to demonstrate some of the seated position maneuvers for range of motion. And Mary, what I'd like you to do is I'd like you to actually lift your knee up off the bed. And so that's going to be flexion at the hip. Why don't you do the same thing on this side? Good. And then can you bring your foot up over here on top of this knee? So that's the internal rotation. We'll do the same thing on this side. Good. And then I wonder if you could just bring your feet out this way. That's the external rotation at the hip. And then abduction. And in order to do this, I'd just like to be sure that our drape is going to keep you well covered here, if I may. And then I'd just like you to have you bring your knees apart and then back together. And so that's abduction. Next, we'll do flexion at the knee and extension at the knee. Mary, I'd just like to have you lift your leg up all the way, extended, and back down as flexed. And again, up and it's extended, and down as flexed. And we'll do the same thing at the ankle, where you bring your toes up towards the head and then point them down. Excellent. And can you turn your ankles out? Okay, so that way. And that's called eversion. And then inward is inversion. Next, we're going to do the motor examination of the lower extremity. And we'll start by just inspecting, looking for any involuntary motions or movements of the legs and leg muscles, looking for any atrophy of the muscles or asymmetries. Next, we can check for muscle tone. Mary, I'd just like to lift your leg up here, if I may, and I'm feeling the quadricep muscle while I move the leg through a passive range of motion, feeling for twitches, flaccid or relaxed muscle, or spastic or tightened muscle. Next, we'll move to strength testing. We're going to start with testing flexion at the hip. There are some techniques for testing hip strength with the patient lying, but we're going to perform them seated today. And Mary, I'd like to start by asking you to lift your thigh up off the bed. Very good, against my resistance. I always want to compare the two sides. Very good. And that's the iliopsoas muscle innervated by the femoral nerve, which is L23. And next we're going to check flexion at the knee. And I'm just going to put two hands here and do these simultaneously. Mary, would you just straighten both of your legs up? Good. And then just relax them back down. And that's testing the quadricep muscle, which is also innervated by the femoral nerve, but more at the L3, L4 level. Next, we're going to check dorsiflexion of the ankle. Mary, I'm going to ask you to lift your toes up towards the ceiling against my resistance. Very good. And that's testing the tibialis anterior, which is innervated by the peroneal nerve, which is at L4, L5. And then plantar flexion, push on the gas pedal on both sides. Very good. And that's testing the gastrocnemius muscle innervated by the tibial nerve.